Hi everyone, and welcome to our health and social care wing, where today we are going to be interviewing one of our course tutors, Michelle, which will hopefully give you a bit more of an insight about our amazing courses. So hi Michelle.
Hi.
Today can we ask you about a little bit about yourself? For example, how did you start your career within the industry and what roles have you had?
I started actually at this college in 1982. It was then Redcar Technical College. So I came here from 1982 to 1984 on a health and social care course. I did placement 1 day a week, and I went to an old people's home on my work placement and then to a special needs school. When I left here in 1984, I actually got a job within a local residential home where I was the 7 to 11 girl doing 20 hours per week, sort of providing personal care, bathing, feeding, that type of thing. I then progressed my way up within the home to actually a relief care manager. So I went from there from 1984 until 1995, and then I left that care home and I got a manager's post within a local care home within Redcar, and I was there from 1995 until 2009 as sort of registered manager, manager of the day centre, and overlooking the site, the scene of the establishment. I then went to Darlington College and I became an assessor. So I was assessing all the students on health and childcare within, again, all the care homes around Darlington, North Yorkshire. And then I was lucky enough to see a job here for a health and social care lecturer's post. So that was in 2014. I came for that job, but I actually was successful in getting the access to health role. So I'm sort of currently the access to health tutor on that. But then within the college, I've just been given the programme area lead of Access Health and Childcare. So I oversee the running of the health and childcare department at the moment.
That sounds brilliant. So you've got a lot of
26
experience
years
within the
26
industry.
Years in health and care.
So why did you choose a career within this industry? What was it that made you want to be involved in it?
I don't know really. I don't think I made my mind up until I did placement. I think I came on the health and social care course because I didn't really know what I wanted to do. I didn't want to go into working as a receptionist or working in business or anything like that. It just wasn't for me. And I will be honest, in the times of the qualifications, it was O levels at the time, and I got my O levels in sociology, and I thought, that must be the way for me. So I came here and, like I said, did the 2 years in health and social care, and going into those placements made me realise what my vocation was.
Yeah.
I did 6 months, like I said, within elderly care for the first 6 months. Then I did a special needs school, and that just was not for me.
Yeah.
I thought the elderly were more sort of my sort of vocation, and that's what I went into. So the second year of my course, I actually did a full year in the placement. It was actually a home called Lodge Farm in Eston. So, and that's gone now, it's all been tore down, but I did that for a year, and I was lucky enough that the matron offered me a job whilst I was still on placement there.
Yeah.
So as soon as I finished college, I then went to a full-time job.
Straight into it.
Yeah,
brilliant. And is there anything in your career that stood out for you, any positive experience, anything that you could sort of tell your students about and they learn from that?
I think for me, it's the world's your oyster. I've gone from being a care assistant to being a manager, to being a tutor, to now being a manager of a department in the health and childcare.
Yeah.
You can do it. I mean, I only went to university through doing my teaching degree type, but it is out there.
Yeah.
Within health and social care, there's so many different pathways and so many different doorways are open for you.
Yeah, so it does show you that if you put your mind to it,
you can achieve, and that's that's why I was that 16-year-old in 1982 coming to this college.
Yeah, and that's really good.
That's why I always, if ever I go into classes, that's why I always say to the students.
And I bet the students can relate to you a lot more because you've
I've
been
done the
there
job
yourself.
I've been there.
Definitely. So some of our students have asked what type of job roles can you get if you study a health and social care course with us?
You can go into care assistant, so a health and social care care assistant in a care home. You can healthcare assistant within a hospital as long as you've got your level 3. You can work your way towards an assessor, the same as I was. Anything within the health and social care field. as long as you have the right qualifications, your level 2 or your level 3.
Yeah, so the basics of it,
Yeah,
you can
the
really
big,
go
yeah,
into
yeah.
anything.
Yeah.
How long are the courses, roughly?
Depending on what course you come on.
Yeah.
So if you come on the level 2, that would be a 1-year course. And then the level 3 is a 2-year course. So you would do, there's 2 parts. You would do a certificate, and then you would do an extended diploma.
Right.
So that the first year is, you do things like communication, working in health and social care, equality, diversity, safeguarding, which is a biggie within care establishments. You would do that. Then again, in the second year, you will do things like psychosocial aspects of health, again communication, but in a more diverse way, dementia care, end of life. You would look at all the palliative care as well, and that sort of gives you the grounding to go and work into the health and social care environments. And that is a 2-year course. Like I said, you do 1 year, 2 years, and then you can progress on to university.
Yeah, that's really good. Do you offer any course-related trips, or do you do any like residentials or any trips as part of the health and social care courses?
We do offer a trip in, it's the end of the term, so it's normally the end of May, beginning of June, you go to Romania.
Oh, brilliant.
So you go to Romania for a week and you go and work in the orphanages and, people who haven't got everything that we have over in this country.
Yeah.
You've got all those different experiences of working with the gypsy colonies.
Yeah.
It's a bit about looking at what is provided within the healthcare over in Romania to what's over here, the difference in the hospital facilities and everything like that. It's a real eye opener.
Yeah, I was going to say.
And every student on the level 3 will have a chance to go onto that trip.
Oh, brilliant! So that's something to look forward to. One of our students have asked, what is the difference between the general health and social care courses and adult health and social care?
Well, the adult health and social care, they're near enough more or less the same.
Yeah.
Except it depends. Like I said, the second year is more moulded towards you going into Teesside University.
Right.
So you would look at units that are going to help you progress into paramedic, ODP, which is occupational departmental practitioner, into nursing, the 5 areas of nursing: midwifery, learning disability, mental health, adult nursing and child nursing.
Yeah.
They're all specialised, and they'll give you the grounding and the knowledge that you need to progress to university. We also help with UCAS, your UCAS application.
So you get fully support.
So you get full support on your UCAS application, your personal statements.
Yeah.
You get advice and guidance on how to complete them, and it's all here for you.
Yeah. So you really are set up ready to proceed on to what you want to do. Some of our students have asked if you need to wear uniform.
Yes, you do. We've just started it this year, and actually this is one of the tabards that you would be wearing. Yeah. So I just think with the uniforms, it gives you a sense of purpose.
Yeah.
It makes you feel like a professional before you go out into the world of professionalism.
Yeah.
And that's, I just think it'll help the students and the learners be prepared for that, what's expected.
Definitely.
What's expected.
They're really nice as well. So the last question that we've got is, how often do the students spend in this hospital wing?
Currently lessons are facilitated in here, but we are looking as of January this year to have at least 1 day a week for each course to do practical skills.
Oh, brilliant.
So they will be doing practical skills because we have got an ambulance, we've got the care ward, as you can see.
Yeah.
It's all set out in the layout of a hospital environment, rehabilitation, the sluice. So you would have specific areas that you would be doing role playing every other week.
Well, that's been brilliant. Thanks so much, Michelle, and we hope that you found it really informative today. What we're going to do now is give you a little tour around our hospital wing just to give you an idea of where your lessons will be.